In a world where we trust doctors with our lives, sometimes that trust is shattered. Picture this. Samantha Smith, a hopeful mother-to-be, steps into the hospital, her heart filled with anticipation and a tinge of anxiety. Unknown to her, she's stepping into a nightmare that will forever change her life, and that of her unborn child, Christopher. The initial signs were concerning. The erratic pattern of her baby's tiny heart beating away in her womb was enough to send alarm bells ringing. In such situations, an emergency cesarean section is often considered a safe bet, a potential lifesaver. But the decision that day was different. The doctor, in his wisdom, or lack thereof, decided to slow down Samantha's natural labor with medication. What happened next was a series of events that should send chills down the spine of any expecting parent. The doctor, with Samantha and her baby in a precarious situation, chose to attend to 2 other births. It's like leaving a ticking time bomb unattended. Meanwhile, baby Christopher's heart rate, the rhythm of life itself, continued its dangerous dance towards the abyss. It was deteriorating, fading, like the last embers of a once roaring fire. But the nurse, perhaps overwhelmed, perhaps negligent, did not call for a doctor. Every second counted. Every second without medical intervention was a step closer to calamity. Yet the hands of the clock kept moving, indifferent to the looming crisis. The heart rate monitor continued its monotonous beep, each one slower than the last, each one a stark reminder of the peril baby Christopher was in. It's in these moments of crisis that we look towards the people in white coats, the ones we entrust our lives to. But in this instance, the trust was shattered, the faith was broken. The doctor was elsewhere, the nurse was silent, and baby Christopher was slipping away. But the nurse did not call for a doctor. The clock was ticking, and baby Christopher was in danger. When time is of the essence, a delay can mean the difference between life and death. This chilling reality was all too apparent in the case of baby Christopher. An hour had passed since his mother's concerning fetal heart pattern was first detected. An hour in which the doctor attended to other births, leaving Christopher's deteriorating heart rate unattended. An hour that would change the course of Christopher's life forever. When the doctor finally returned, he was met with a dire situation. Baby Christopher was in terminal bradycardia, a medical term for a dangerously low heart rate. His small, fragile heart was beating too slowly to supply his body with the oxygen it needed to survive. The nursing staff, in their desperation, had attempted to deliver baby Christopher vaginally. Yet, faced with this critical situation, the doctor made a decision that would prove to be catastrophic. He chose to proceed with a forceps delivery. This method, while sometimes necessary, carries significant risks, especially when performed under such stressful circumstances. The doctor, perhaps feeling the weight of the ticking clock, also used a vacuum extractor to aid in the delivery. Every medical procedure has its risks and benefits, but in this case, the balance was tragically tipped towards the former. The forceps, cold and unyielding, left baby Christopher with a massive skull fracture. The vacuum extractor, designed to gently guide a baby into the world, instead caused extensive bleeding on his brain. But the injuries didn't stop there. Christopher's brain, so new and yet already so battered, suffered further damage from oxygen deprivation, also known as hypoxic ischemic encephalopathy, or HIE. This condition, often associated with birth injuries, can lead to lifelong complications and disabilities. The doctor's forceful delivery left baby Christopher with a massive skull fracture, extensive bleeding on his brain, and severe brain damage. And as we'll soon discover, these injuries were just the beginning of Christopher's heartbreaking journey. In the wake of a storm, the extent of the devastation slowly surfaces. As the dust of the delivery room chaos settled, the magnitude of the catastrophe that had befallen baby Christopher began to reveal itself. A grim constellation of injuries marked the beginning of a life marred by the reckless decisions of those who were meant to protect it. Christopher was left with a massive skull fracture from the attempted forceps delivery, an injury that in itself is a testament to the force and brutality of his birth. But the skull fracture was just the shocking prologue to a series of devastating chapters. The vacuum delivery resulted in extensive bleeding on his young brain, a terrifying occurrence that no newborn should ever have to endure. But it didn't stop there. He also suffered from oxygen deprivation, a condition known in medical parlance as hypoxic ischemic encephalopathy, or HIE. This lack of oxygen led to an ischemic brain injury, a type of harm that can have long-lasting and severe neurological consequences. These injuries, these horrific events at the dawn of his life, have led to a diagnosis of cerebral palsy, developmental delay, and mixed expressive receptive language disorder. A cocktail of conditions that will render Christopher dependent on others for his entire life. A life that will require 24-hour care every day for the rest of his days. We now turn our gaze to the criteria for medical malpractice. A doctor has a duty to provide a standard of care that is accepted in the medical community. In Christopher's case, this standard was not met. The doctor's decision to prioritize 2 other births over Christopher's critical condition, the delay in performing an emergency cesarean section, and the use of forceps and a vacuum extractor despite the baby's deteriorating heart rate all paint a picture of gross negligence. Medical malpractice is when a healthcare provider causes injury or death to a patient through a negligent act or omission. The injuries to baby Christopher were not mere accidents. They were the direct result of decisions made under the doctor's care. The damage was done, and the consequences were irreversible. When justice is sought, the courtroom becomes the battlefield. In the heart-wrenching case of Smith v. Mercy Hospital, the legal proceedings were nothing short of a fierce tug-of-war. The plaintiff's side presented a compelling argument, painting a vivid picture of the events that led to baby Christopher's life-changing injuries. They argued that the doctor's decision to delay the cesarean section, the nurse's failure to call for help, and the forceful delivery methods all contributed to the irreversible damage. On the other side, the defense was equally zealous. They argued that the doctor and the nurse had acted within their professional judgment, that they had followed standard medical procedures, and the outcome was an unfortunate, unpredictable event. In the midst of these arguments, the standards for medical malpractice came to the forefront. To prove medical malpractice, 4 elements must be established: a duty of care, a breach of that duty, causation, and damages. The plaintiff's side argued that the doctor and the hospital owed a duty of care to Samantha and her baby, which was breached through their delayed and inappropriate actions. The causation was clear. Baby Christopher's injuries were a direct result of the delayed cesarean section and the forceful delivery. And the damages, they were all too real. The life of a 4-year-old child, forever altered, with a future filled with medical care and challenges. The defense, however, contested this. They maintained that there was no breach of duty, as the actions taken were in line with standard medical procedures. They argued that the causation wasn't clear-cut, that there were other factors that could have contributed to baby Christopher's condition. They contested the extent of the damages, claiming that medical advancements could potentially improve his condition in the future. The courtroom was filled with tension as the 2 sides presented their cases. The jury, the judge, the audience, they all listened, captivated by the battle of words and evidence. The jury was left to decide, was this a case of medical malpractice? In the quiet of the courtroom, a verdict can echo like a thunderclap. The anticipation was palpable, the silence deafening, the room bristling with tension. It was a moment that would forever change the course of Samantha Smith's life and that of her son, Christopher. The gavel falls. The largest medical malpractice verdict in Iowa history is declared. $97.4 million. A figure so immense it reverberates through the room, each syllable a testament to the gravity of the injustice endured by Samantha and her son. About $42.2 million of this monumental compensation was designated for future medical or custodial care. This sum, though substantial, is a stark reminder of the lifelong battle Christopher faces, a battle born out of negligence and delay, a battle that no 4-year-old should ever have to fight. The remainder of the compensation, amounting to over $55 million, was awarded for loss of future earning capacity, pain and suffering, among other damages. This portion of the verdict acknowledges the profound impact of the events in the delivery room on Christopher's future prospects. His ability to lead a normal life, to earn a living, It recognizes the immeasurable pain and suffering both he and his mother have endured and will continue to endure. These numbers, however staggering, are but a fraction of the story. They cannot fully encapsulate the trials, the heartache, or the resilience of Samantha and Christopher. They cannot quantify the loss of a normal childhood for Christopher or the relentless worry of a mother for her child. But they do serve as a potent reminder. A reminder of the dire consequences of medical negligence, a reminder that every second counts in the delivery room, a reminder that justice, though often slow, can be served. They serve as a beacon of hope to others who may find themselves in the same harrowing situation, a beacon shining the way towards justice and accountability. Justice had spoken. The verdict, a staggering $97.4 million. It was more than a number. It was a message, a warning, a promise of accountability. It was, for Samantha and Christopher, a small measure of solace in their ongoing ordeal.